Let me repeat that. I'm going to cut that part out.
We got
All
this.
right, here we go. Here
I
we
got
go.
wine ready. I got wine ready for when we're done.
Hello, ladies and gents. I'm Nurse Dad, former Navy hospital corpsman and current ER nurse. And welcome to the special relaunch episode of my podcast, Nurse Dad. What is Botox? What are fillers? And what does it take for someone to become an injector? Whatever your opinion, one thing is clear. This industry is becoming more and more prevalent in our culture. And I love the idea of conducting the first ever interview on this podcast with my fellow nurse and friend, Brittany.
You have my undivided attention.
As travel ER nurses at the time, Brittany and I first met at a level 1 trauma not far outside New York City. I'd go on to stay there for about a year while Brittany slowly transitioned to becoming an injector full time. Now I admit, before this interview, I knew practically nothing about Botox and fillers.
I'm a jock. This is a jock bar.
Now without further ado, here's my interview with Nurse Brittany. Was that fancy? What I really want to say is, let's kick this pig. Man, I'm like tongue-tied. Okay.
I'm so happy that this is you and not somebody. I've done this before with one person, and it was so awkward. There was no pauses, and it was just.
I have a lot to get used to doing this. Well, this is Nurse Dad, and I'm here with Brittany. She goes by Your Botox Bestie on Instagram, and we're going to have a conversation about something that I guess you started doing this when?
About 5 years ago.
We worked for almost a year in the ER together, a level 1 trauma.
Yeah.
And
2 years ago, I think, right?
about 2 years ago, we worked there for almost a year. Kind of chaotic, but we made it work.
Vast understatement.
I remember during that time you were administering Botox, so you kind of doing both. And now you're just exclusively doing that, right?
Yes.
What attracted you to the ER? What made you become an ER nurse?
I love the idea of the fast-paced nature in the ER. Also, that you get to learn so much and see so much, be exposed to pretty much every sort of, injury, illness, disease. You're really getting the most out of nursing that you possibly can there. I think that people that work in the emergency room naturally work well in very fast-paced environments and kind of like organized chaos. So I
That's a
feel
good way to
like,
put it.
yeah, so I feel like maybe that's where we share a common interest and how we became friends.
Yeah, it kind of, for me, also, it felt like when I was in the military, in the field, providing medical care to Navy personnel and the Marines, you're more independent in the ER. In my experience, administration, leadership, they kind of leave you alone, especially in the big level ones. That's kind of how I like it. Just as the least amount of games as possible. So what attracted you to wanting to go into administering Botox in the first place?
Well, first of all, I'm a girl and we love beauty, skincare, makeup, all that stuff. So I grew up always interested in, makeup, beauty, all of that stuff. To be honest, I love Botox personally. So that really got me interested in administering it because I feel like to be in the aesthetic space, you really have to be artistic and have that creative eye. And when I first got Botox done on myself, I actually had a pretty bad experience. I love the idea that there is a space that you can combine beauty and science. So all of the nursing knowledge and everything that we got in school about anatomy, everything that you have, but also beauty and art. And then out of that, you create confidence in women and connectivity, which is all very much my passion.
When you work, do you work with a physician next to you or someone else, or are you well, you're probably on your own now, right? Like you're just doing it by yourself?
I am doing it by myself. I have an overseeing medical director. In New York, as an RN, you have to have a medical director to work under.
So what does a nurse have to do to be certified to administer Botox?
You have to obviously hold a registered nurse license, and then you take a certification course. which is just actually, believe it or not, it's only a day. There's a lot of companies that offer the courses. You go, you take it, but it's really important in the industry to continue your education because there's countless trainings, advances in techniques, technology, different products come out. Although the course is only a day long, it's really continuing your education endlessly that is going to keep you and your skills intact and keep you kind of up to date with the latest trends and techniques.
What you said that segues into something I wanted to ask you. What is the continued education like? Is it more licenses that you have to achieve, or how does it, or classes you have to take? How does that work?
After the initial certification course, you'll get, your Botox and filler training certificate. And then after that, you get similar to how you take CMEs to hold your
Mhm.
nursing license, and you would also get geared towards injecting. Recently, I just took a cadaver course in the city, so I got CME
Yeah.
credits for that, and I got an advanced training for injectables and safety.
How nervous were you for the first time, when you were going to inject somebody?
I was terrified. I was so scared because it's somebody's face and these are
Mhm.
women, so you know that they're not taking it lightly. Thankfully, I had family and friends that were willing to let me practice and learn on
Oh, I didn't
them.
think about that. Yeah, it's funny.
And with Botox, it's not immediate gratification. You have to wait 2 weeks for it to settle. So the first time I was injecting,
Right.
I was so nervous for 2 entire weeks. I was like, God forbid something goes wrong or I misplaced something. It was obviously it came out well, and that's when I kind of got my little boost of confidence, like, okay, I can definitely do this. But it was scary for sure, I won't lie.
So you could do it and it might look right, but in 2 weeks, something could happen.
Right, so the results aren't instantaneous. It takes 2 weeks to settle, so you're leaving the office looking exactly the way that you came in.
Oh, that's interesting. I didn't know that.
Yeah, with Botox, not with, filler. Filler, you do see immediate results, but with
Oh, so filler, this just showed you how ignorant I am. So filler is not Botox.
no. Filler is used for volume deficit. Botox is used for, muscle relaxing. So Botox is a
What
neuromodulator. You use that for, wrinkles and lines that are caused by muscle contraction, and
Right.
filler is used to fill volume loss due to aging, gravity, all of those fun things.
What is filler? What does it look like?
It's a hyaluronic acid based, it's like jelly. They all have different viscosities. There's countless fillers on the market. So some of them are super thin like water, and some of them are very dense because they're supposed to mimic bone. So naturally, they have to be thicker than the ones that are going to go superficially.
Mhm. I had no idea.
There's a whole
Okay, so
science behind it.
filler is not Botox. Oh, I'm sure that it goes way into depth but I had no idea that filler is not Botox.
It is not Botox. No, it
All
is
right.
not.
As a former ER nurse, I'm sure you have a lot of confidence that other nurses who are doing what you're doing just don't have. Has there ever been a situation while administering Botox or filler where you had an emergency come up and you had to be an ER nurse again?
I wouldn't quite call it an emergency, but there are a few people that have syncopal episodes when you're injecting. So, as an ER nurse, no big deal at all. But as maybe a newer nurse or somebody who's not exposed to that so often, it could definitely be scary. I've definitely been around quite a few people that have passed out, and you just, you know, protocol for syncopal
Yeah.
episodes. Wake them back up, and all is well afterwards.
Yeah, fainting and vomiting, very dramatic looking, but not really the biggest deal in the world.
Yeah, I, when you have been exposed to that, it's not that big of a deal. But when you're not, I feel like it could be very, very dramatic because sometimes when you faint, it kind of looks like you're seizing.
Yeah,
Um,
right, right.
and you turn super pale, you start sweating. One time,
Which you're fine with anyway, because we
right?
get a lot
And
of seizures.
I tell my patients, I got
Not in
you.
Botox, in the ER. We get a lot of seizures, a lot of
Yeah,
seizing patients in the ER.
No, yes, not in Botox. No, not many seizing people, but for the people that have like a fear, oh, I might pass out, I might throw up. I'm like, I got you. Don't even think twice because even if you have a heart attack right now, like you're safe. I got you. We're good.
What advice would you give a nurse who's interested in doing what you're doing? How do you even sign up for getting this license?
Google Botox and filler trainings near me. All of the companies that do it are, from what I know, a lot of them are traveling. So they'll be in a major city near where you live, every couple months. Or I'm sure there are ones that are local that you can just take, wherever. But I would just Google it. But I do have some advice for nurses interested in doing what I'm doing. So if someone was to want to be an injector as a nurse or even nurse practitioner or PA, the best advice that I can offer at this point in time would be have patience. Never stop learning. Everybody always has something to teach you, regardless of how much you already know. And don't compete with anybody in the industry because we're all in it together and we're all growing together. We can all learn and grow with one another. And it's really such a nice and beautiful space,
Do you find
figuratively,
that when
really.
do you find that that's there in the air sometimes? Like you have different nurses or people giving, administering Botox or fillers, and they're sort of competing with each other. They're trying to get repeat customers or take customers from other people. Is there that kind of like infighting or competition?
I hear a lot of things about people being competitive with, who's more popular, who has more patients, or does this patient want to see this provider instead of that provider? It shouldn't be your ego and personal opinion. I don't think there's a place for it in the aesthetic space.
That's how I feel with that's another reason why I like the ER, because on the floor I noticed there's a lot of that. I've noticed a little bit more games that are played, especially in the big emergency departments. You really don't have time for that kind of nonsense.
When I was in the emergency room before the one I was in with you, where we met, it actually was very divided and it made me feel so uncomfortable and kind of disheartened because, we're all for what I thought there to help people and nurture. That's what we do as nurses. So when there's that competition or animosity or any sort of drama really, I just don't agree with it. But when I went to Nassau where we met, I feel like that was the first time in the emergency room that everybody just worked so well together, really had your back, made you feel confident and empowered, and really it was about the nurses. Even the doctors supported us and
Yeah,
you
first name
know,
basis with everybody.
yeah, which is
You kind of
how.
had to because it was split into A side and B side. So if you were the B side nurse, you had up to 8 patients, and then you were also going to be part of the trauma team. And if you were on the A side, you had up to 8 patients, and you'd be part of the resuscitation team. So cardiac arrest comes in or anything that's not trauma. You go into the room, say it's the trauma room, somebody would have to watch your patient. You'd have to give report to maybe one or two nurses or just tell them, hey, I have to go. Can you just look and make sure everything's okay? No choice but to get along.
Teamwork is what it's all about in nursing and life in general.
How should I ask this?
Oh,
In terms of salary, how would you compare what you're doing now, which is exclusively administering Botox and fillers, to your nursing salary as an ER nurse?
I would say the salary is comparable to, your average nursing salary in New York. The time commitment, especially if you're working independently, is definitely a lot more, but that just comes with the territory. It's now a business. It's not bedside where you're working 3 12s a week and then getting the rest of the week off, not and you don't have to think about anything. It's 24/7. You're available for your patients. You're
How many
documenting.
how many days do you go? Like you have to go into the weekends, any day during the week. How does that go?
Right now, I'm there 4 to 5 days a week. It is luckily only like 10 minutes from my house where I work right now. So I can pop in on the days that I'm off if somebody wants to come in and see me. But I'm really in the growth phase of business. I'm still, building and growing a clientele and making connections with people and trying to get the business up and running on my own.
Hello, folks. I hope you're enjoying the interview. Before we go back, let me announce I wrote a children's book, Isabel Learns to Share, a love letter from me to my firstborn daughter, Isabel. It's available on Amazon, but let me be clear. In a world of AI, this book is written by me, every word of it. Everything this book earns goes right to the podcast. This book emphasizes family values, respects parents, and respects children as they go through life making mistakes, but ultimately learning how to become their best selves. Click the link down below, support the podcast, and get yourself a copy. Thank you very much.
I've seen one of your nurse dad things. Didn't you show me
I
a
think I
video?
sent you a few clips.
Yeah, and it was
Yeah, I
great.
think I'm changing the format around, so there's no more like green screen. I just want to have like a set in the background, use lights, kind of have more of a organic feel, something that's like easier to film. There's just a lot of stuff out there. I don't really see the nurse's point of view. It's always some doctor or guru or something. I just want to like listen to an RN talk. Even like just regular videos on YouTube when it's an RN in their car just
Hmm.
talking about what they're going through. I find it fascinating.
It 100% is so fascinating because we're the as sad as it sounds, like the bottom feeders. We're the ones that go through all the shit, good and bad, but definitely the most interesting point of view and perspective that I could think of in the hospital.
The nurse is the real bedside. Everyone else kind of checks in. You
Yeah,
know, a
exactly.
nurse literally has their computer on wheels for a reason.
Yeah, yeah, you're
You
absolutely right.
reminded me of a question I wanted to ask in terms of, you said bottom feeder. You had mentioned before in terms of administering Botox, getting the training, nurse, physician's assistant, a nurse practitioner. What is the lowest, I guess, tier? Is it RN? Like, can you be an LPN and do this?
I don't think so. I think RN is actually the lowest, license that you can
Mhm.
hold to administer Botox in New York. I heard, I mean, and don't quote me on this because I don't live there, but I heard that in other states, you don't even have to be a licensed medical professional. I can't tell you exactly which states, but I know that there are
No.
some that you don't have to be, which I find alarming.
From the things you spoke about, how, whether it's a syncopal episode or anything that might pop up, it would be helpful to have a medical background.
Yeah, definitely. I mean, you
I,
hear about people getting treated, in the back of an alley somewhere, and then they wonder why they come out with such poor results. And I'm like, well,
I-
maybe you should look into your provider just a little bit before you get a botulism injected into your face.
you have any advice for that? For someone who's considering getting Botox or fillers or have done it before, is there a definitive way they can research the person they're thinking about going to and what they're using?
You can always research, providers, but what I always tell people is to ask. You should never really be getting anything injected into your face or body without knowing exactly what it is. I've had many patients that have gotten treated in the past, and then they come to me and tell me about how they didn't get the result that they wanted, or they had a ptosis, or it just wasn't what they were looking to achieve. And then I asked them what product was put in your face, and they have no idea and didn't
No
even think
idea.
to ask. So my advice to anybody interested in ever getting anything done would be to ask. Ask the provider for their credentials, ask them
Mhm.
how long they've been practicing, ask them exactly what's going into your face. Transparency is very important.
That's a really good answer. Talking to you made a couple questions kind of come to me.
It's a different atmosphere and aesthetics. It's really, really so much fun. I can't say that it would
Sounds
be
like
for
it.
you because you're not a girl, but
Nobody wants to see me, nobody.
it's
I've done, in the Navy, I've done suturing, in the dark and, someone's face. I know I can keep my hands steady, but nobody wants to see me.
I
That's,
really think that you would be surprised because is so much more about connecting than it is with
Mhm.
anything else. Like
I
people,
imagine. I imagine that.
it's like a, a
Like
hairstylist. Like
who?
people go because they're comfortable with you and they connect with you.
Right. Well, this has been great. I actually learned a lot more than I thought I would. Fillers not being Botox and the difference, and just your journey with this and everything that you're doing. I want to thank you, Brittany, for doing this. My first interview on this podcast, and I have a lot of work to do, a lot of bugs to work out. Thank you for bearing with me.
Of course, my pleasure. It was so nice talking to you, catching up.
Do this again, and we'll do a follow up. I'll post a link to your Instagram on the description below, and people can click and find you there and ask you any question that they can think of. Hopefully, it only relates to Botox and fillers.
Yes, I'm happy to answer any questions. I get messages all the time with questions, Feel free to reach out with any questions you have. I'm happy to answer. And it was great talking to you and catching up.
Yeah, thank you for doing this. I appreciate it.
Of course.
I hope you enjoyed my interview with Nurse Brittany, as wet behind the ears as I may have been in conducting interviews. All I can say is I'm here to rock and roll and get better at everything that I do. We've got some great interviews lined up for this podcast, and this is a podcast I really believe in. Nursing, like in life, is about collaboration, and that's what this podcast is about. Just to be clear, Nurse Dad is a podcast that values opinion, believes that life is a collaborative experience, and aims toward common sense in everything that it engages in. Everybody is welcome here. Having said that, I'm Nurse Dad. I'm a veteran, I'm a nurse, I'm a husband, I'm a father, and I'm not unfamiliar with the B-side of life. This is a no-holds-barred podcast. This is not a safe space, though we respect everybody in this space.
Fascinating.
To reiterate, we value opinion here, and we strive for objective truth, and we stay within the realms of common sense. Sometimes people get offended, sometimes they don't, but that doesn't change the truth, does it? Things aren't squeaky clean in the profession of patient care, and they're not going to be squeaky clean here. Now, before I go, I'll leave you with some Nurse Dad wisdom. It's okay to make a shitty day worse, but never make a good day bad. This is Nurse Dad, out. Nurse Dad here. For you college students or novice nurses, I want to let you know that in the description below, there is a link for 2 free Nurse Dad guides. The first guide I designed for college students on how to better optimize your time so you could do the things that you want to do in life, but still try to go for that A. The second guide is for nurses specifically based on my life experiences as an ER nurse and in the military. Just a few tricks on how to multitask and not burn out in patient care. So whether for you or for someone you know, I hope you find these guides helpful. Thank you very much. Nurse Dad out.